I'm Dr. Rick Buck, and I've been a dentist for 17 years. This patient came in a little while ago with badly infected front teeth. You can see a little bit of pus here in person, and when you look in the x-ray, you can see all of the bone that the infection has destroyed. And so we're gonna attempt to fix all of this. And if you look at all of his front teeth, you can tell his lateral incisors are also misaligned, and this crown over here has a fracture in it. So in this video, I'm going to show you how I take out the teeth and put in an immediate implant bridge and cosmetically restore his smile. So we plan to have the patient come in for this appointment to have his front 4 teeth taken out. Now the reason we're taking out all 4 is that the front 2 teeth have terrible bone because of all the infection that destroyed it, and it would take over a year to build up that bone enough into place so that you can put an implant in there. And the patient just didn't want to wait that long to build up the bone and have it be strong enough to put in implants. The 2 lateral incisors aren't strong enough for a tooth bridge, so they need to come out for a spot with good enough bone for solid immediate implants. After the patient is numb, we start by making incisions in the gums because we are going to need to see the underlying bone and infection to assure us we are working in solid areas and not areas weakened by the infection. After the incision, I am slowly pulling back the gums to expose everything. This actually takes a lot of work because the gums are tenaciously attached to the underlying bone, obviously. Now, 3 of these front teeth that we're looking at are actually a bridge. So we have 1 false tooth where the natural tooth was already taken out in years past. The reason why I'm explaining it is because we have to cut this bridge so we can take the other teeth out one by one. Taking them all out together would destroy the bone, and we need all the bone we can preserve up in the front of this mouth, because ultimately strong bone is what holds in implants. You can see as I drill a slot in the bridge, it is actually shooting sparks as I drill on the metal underneath. Eventually we drill all the way through and have 2 separate pieces of the bridge, each with 1 natural tooth under it. We now grab the most infected tooth and what is left of the false or pontic tooth attached to it, and we apply a lot of rotational pressure. It is already pretty loose and comes out with very little work or force. And I want to only put rotational force and not back and forth force because I don't want to break the bone or cause any damage to it. We need to preserve that bone. If I pause on the tooth as I'm pulling it out, you can see how the infection rotted the tip of the tooth that was in the bone. All right, now we go back and look into the socket. We start pulling out as much of the infected loose tissue as we can, and this is called granulation tissue. My assistant quickly suctions it up as I pull it out. You can see I just kind of tear out all of this tissue with my forceps because it all kind of holds on to each other. I also will scoop some of it out with a small spoon instrument. Now I will move on to the lateral tooth extraction. When I take out front teeth for implants, I always do it with forceps, and I only loosen it by rotating the tooth and not putting back and forth pressure. It takes a little bit longer than doing it the other way, but we have to preserve the bone once again because those other methods can easily break the thin bone surrounding these teeth. The bone surrounding front teeth is so thin actually. I mean, if you can see how thin some of this bone is, you'd actually probably be surprised like I am that it can even hold in a tooth. But if you want to see some of those other methods I used to take out teeth, you can watch other videos I've made. The rotational forces on the tooth are surprisingly gentle on the socket, even that very thin bone. The more trauma there is on the bone, the more collapse of the bone you will get. And the more the bone collapses and you lose of it, the less ideal your final outcome will be. Eventually the tooth does give way and we take it out. So now we move on to the other lateral incisor and we do the same thing, only rotational forces to break the ligaments holding the tooth in place. And eventually this tooth pops out as well. Now with the teeth out, we then take a second to examine all the sockets and make sure the bone is sound all around the circumference of the socket. And also we want to measure how far down the edge is of that socket below the gum level. So next we start to drill a hole deep into the socket where we will eventually insert the implant. Now you can't see the drilling good at this angle of the camera, but when we are done drilling to the correct depth, We widen the socket with drills that are each a little bit larger in diameter than the next, so we can widen the socket. Next, we move to put the implant in place. As I put the implant in and tighten it into place, you should notice a few important things about the placement, and these are very important too. First, you will notice that the implant is further back in the socket with a little bit of space of the socket in front of it. You want that implant to be as far back as possible with still good bone surrounding all the way around it. Now, to make sure I put it in a good place, I also take off the attached abutment to make sure the platform is about 2 millimeters below the crest of the bone. This will ensure as much as possible that as the bone heals and remodels and collapses a little bit, the implant platform is still lower than the crest of the bone. You don't want the bone dropping below the platform of this implant. The angle of the implant is also extremely important, and this will maybe make more sense in a minute, but you want that eventual attached abutment that attaches to this implant not too far forward, because if that would happen, it would show through and cause cosmetic issues. But you will see what I'm talking about with the abutment and the screw channels that would cause cosmetic concerns if the angle of the implant was too far forward. You'll see it later. Now we move on to the implant in the other tooth. And as we make a new hole or socket, it is even more difficult because it has to be as close to parallel. Now the angle and the position of these holes are so important because, as you saw earlier, that's where the final implant will go. And this is even more difficult because it has to be parallel with the first implant and still meet all those other specifications that the first socket and implant met. But now, as you can see, I'm moving on. I have it perfectly in the spot that I want, and it's parallel with the other, and it meets all those same specifications. And so now we screw in the new implant with the temporary abutment on top of it. What I'm doing is I'm seeing how solid the implant feels when I put it into the bone. If the implant isn't into the bone solid enough, I can't put temporary crowns or a temporary bridge on today. It needs to be as solid as a rock to immediately put an implant or a temporary bridge on top of it. So now that we have both implants into place, I take a look and make sure everything is nice before we start screwing stuff on top of it. And also, I want to just note that these implants are in there very solid. These are so solid in there, and they're actually gonna multiply in strength because they're both so solid working together as an implant bridge. So now we screw those temporary abutments back into place that we took out on top of the implants. These helped us insert the implants in, but they also are used to make the temporary bridge. To do that, I cut off the green part of the abutments and then screw them in each back into the exact place they were. And this is what that looks like. Remember that little gap in front of each of these implants that we saw earlier? We're going to fill that gap of the socket between the bone and the implant with a bone graft, which are small granules of bone slightly bigger than grains of sand. We just pack that area with these little granules, and then the socket is less likely to collapse as it heals, since it is important to have the implant platform stay below the crest of the bone. Once the implant sockets are filled with the bone graft, we move on to the large infected socket without the implant in it, because we still want to build up that area where the infection destroyed the bone as much as possible with solid bone. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. So we pull back the tissue pretty far, and we are looking for the end point where the infection was and where there is solid bone. And once we found the solid bone, it's pretty far down. And so now that we're there, we fill that socket with more of the bone graft. I pack the bone in quite a bit, and then I use a slow resorbing membrane to cover it. Now, this membrane is very important, and the slower this membrane resorbs, the thicker the bone will be. What happens is the gums will grow over it, and allow the graft to be replaced by your body's natural bone. If this barrier membrane resorbs too quick, the gums will start to make the bone underneath collapse quickly as well, and the ultimate thickness won't be that great. So I tuck the membrane under the gums and also cut off or fold the parts I don't need. I then use a suture to cover the membrane and graft the gums once again. Next, I move on to cutting away the gums around the implant. The reason for this is I'm going to make a temporary bridge off of a setting acrylic material, and I need that material to go down and grab onto the ridges in that abutment so that it hardens and locks into those ridges and into place. Also, in preparation for the temporary bridge, we fill the abutments with Teflon, as we will need to access these screw channels later, and this Teflon will protect those screws from this process. Now, to make the immediate temporary bridges, we take a vacuum formed template that we made from models of his previous teeth, and we put it over his teeth to make sure it fits and will work in the end. Then we clean up all the blood with a material used to stop bleeding called Viscostat, which doesn't work too well here because of the amount of bleeding. Next, we fill the template and around the implants with a self-setting acrylic. So we snap that into place and we let it set for a few minutes. After that is set for a few minutes, we take off the plastic template and we have our canvas, of which we need to make more cosmetic and detailed teeth. So we take a few minutes to fill in the voids, trim the excess material, and shape this bridge so that it looks more cosmetic. As the patient leaves, this is what the teeth look like. Now, this temporary bridge can be more cosmetic than this here, but it costs more to have a lab design cosmetic temporaries. So this one is fashioned after his old teeth that were just extracted, but the future teeth will be patterned after a more cosmetic design that we'll make. So this is how the patient will be for the next few months. The patient comes in 2 weeks later, and here's how everything is healing up. The gums are looking quite nice actually, so we remove the sutures and check everything out, and it looks great. So we send the patient on his way for another month and a half, and this is what it looks like 2 months later after the surgery. You can see that the gum level has decreased slightly, but not much. And that's why you don't do anything permanently right away. And so here is 3.5 months after the surgery, and the gums are healing great, and we take an x-ray to confirm that everything is healing, the void is healing in, the implants are well integrated. And that's what we note, the implants have integrated well. So we are ready to take off the temporary bridge and make the final bridge. Now, one thing to note, especially with this patient, is to make things more cosmetic, we will also be doing crowns on the canines next to the bridge, so everything matches nicely and doesn't stand out. So after numbing the patient, we get the shade of the tooth that we want the final crowns to look like. This is going to be the shade of the teeth for the final smile. So it's important to note that the patient wants whiter teeth, and so his teeth are going to be slightly wider than his natural teeth. Now what we do is we remove the temporary bridge by drilling holes on the back side of the bridge and uncovering the screws that attach the abutments to the implants. This is why we place the Teflon in at the last appointment. And if this weren't here, we would drill on the screws to the point where it would make them impossible to remove them. So this actually takes quite a bit of time in this case, but eventually we uncover all the screws, we remove the Teflon and unscrew the temporary bridge. So my camera that I was using kind of went through an error, so I'm going to have to skip through some of what I did during this case, but here's what it looks like with the final bridge off. And you can see right now I'm filing the canines down for crowns that will go on these teeth. And so with the bridge off and me filing the teeth down, you can see that the bone maintained a lot of its thickness. So this whole thing is going to turn out great when that bone keeps this much thickness. And as we look down into the implant sockets, you can see that those implants look really nice. They're in there and they're well formed around the gums. I'm completely happy because I know at this point something great is going to go in there. After I'm done filing down the crowns, you're left with these stumps that are called crown preparations, and those also look really nice. So now we're going to move on to scanning the teeth. First we scan the top and then the bottom teeth with nothing on them. We just scan them all into place, and this is kind of what those look like. So this scan will show up as a 3D image that the lab will use to make the bridge and crowns. You can all see this is cool and kind of futuristic, but once those scans are finished, we screw in pieces called scan bodies. These scan bodies will tell the lab the exact orientation of the implants so they can make a model that they will use to build a bridge and crowns on top of. And you can see here, this is what the scan looks like with those pieces and also without those pieces. Technology is just amazing, isn't it? This has just revolutionized the field of dentistry. Okay, that's a fun little process, and now we have the scans done. So now we screw back the temporary bridge into place, and we make temporary crowns for the canines in a process like we did for the temporary bridge. And as we're done with this, this is what the crowns look like as the patient leaves today, and we have sealed off those holes we made earlier with a temporary filling. So this is how they leave, and then they come back for the final appointment. And before that appointment, we get the crowns back from the lab, and we just kind of look at them and practice putting them on and making sure that everything is smooth for the final appointment, just to verify so that we don't have any surprises when the patient gets there. And so now we're just going to do that same process again, where we uncover the screws and unscrew the bridge from the implants. And so here we rinse out the implants to kill any bacteria that may be up in the implants as they've healed for the last couple months. And then after taking out the temporary bridge, we take off the temporary crowns by wiggling and pulling them off as well. Finally, we take the final bridge and screw it into place. Now you can see that this bridge has little screw channels which we can put our drivers in and screw the screws and mount it to the implants. Now once we screw the final bridge into place, we tighten it with 35 Newton centimeters of force to make sure that this will stay in place long term. We also check with an X-ray to make sure the bridge is fully seated into the implants. Then we check the bite and cosmetics and make any necessary adjustments so that these look and feel nice. After the adjustments are made, we try in the crowns, and if you want to know more details about the process of crowns, you can watch all my videos on that. But after the crowns are in place, if everything is good, we cement on the crowns permanently and we seal off the screw channels that screwed the bridge into place with white fillings. You can also watch some of my other videos if you want to see more on that. And this is where we are at. A lot of work goes into these implants, but the results, as you can see, are amazing. At least I think the results are amazing. So if we were doing more of a comprehensive treatment where we're working on more teeth on the top and bottom, we would have got even better results as all the teeth would have matched. But these are still pretty awesome and are a much better upgrade than the teeth he had in there before. And he's completely happy with them. And so this is what it looks like in only 4.5 months time. And during those 4.5 months, he still had a solid temporary option that looked pretty nice as well. The patient was completely happy with everything in the whole process. This could have taken longer, like I said earlier. If we wanted to build up the bone, we could have put in implants here that would have been just the teeth and there would have been no pink gums underneath it. But so that we can do this in 4.5 months time, the patient was willing to just add those pink gums and accept the fact that the bone is not going to be built up to its point that it would have been without so much destruction from all the infection. So the patient is very happy because we cut back on the time. We didn't have to do the whole 1.5 to 2 years option. We just did this in 4.5 months and they are completely happy. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.